Everyone, it's our live going with naturopathic Dr. Shayna Keller. I'm super excited to be talking to her today. She has an awesome account. She talks quite frankly. She loves a bit of poop humor, just like myself. And she's also called the Heartburn Doctor. So we are going to talk about all things gut health, heartburn, SIBO, bloating, how those things can be connected or are connected. And you can also ask questions. So I'm just gonna let Shayna in. Where is the request? So get ready to ask some. Hi, Helen. Hi, Nadina. Good morning, everybody, or good evening, wherever you are in the world. Hi, Shayna.
Hey, how's it going? Glad we got it figured out. How are you? I'm great. How about yourself? How do you say your name? Alana?
Aline.
Aline. Awesome. Good to meet you.
Yeah.
And it's Tuesday morning there, right?
Yes, I'm in the future.
You're in the future. We're talking in the past, but it's Monday evening for me. Crazy.
And you look like you're somewhere spectacularly in nature somewhere. Where are you?
I am sitting on my porch. We've got a little sweet backyard.
Amazing.
Mm-hmm.
So yeah, I'm so excited to talk to you. You probably have a personal story like most of us do. How did you get to call yourself the Heartburn Doctor? Tell us.
I got diagnosed with reflux when I was like 15, 16. And you know, the whole story of like, oh, here's a PPI, you know, eat your Tums. It was Malox that did it for me over Tums. I'm not sure what they have it there, but it's calcium carbonate tablets, same, you know. And I would get the Costco size bottles. Costco's like the bulk purchasing store we have in the United States. And I would go through like 2 of those bottles in a week. Like they were just candy. I had some I kept at school. I had some I kept to my bedside table, some in my backpack. Like it was ridiculous. Turns out medication played a big role in the development for my own issues. I was on a lot of medications by the time I was 17, 10 meds. I'm on 0 medications today.
Amazing.
And the lack of support I got from the conventional community, not to dog them, but you know, we've all, oh, your EGD's normal. Well, you just have a little gastritis. That's normal. No, it's not normal. Common does not mean normal.
Yeah, absolutely. And that's kind of why we're on that same mission, right? I see it as, oh, but that's normal. That's normal. It's like, no, it's very common, but it's really not normal.
Exactly.
So what, you know, I obviously know, but please tell us, in your opinion, what's the causes, what can be the root causes of these?
Yeah, there's a lot of root causes. So as I alluded to with my own health, medications, and this could be allergy medications, it can be psychiatric medications. Allergy medications are a big one for young people. Generally, young people aren't on things like statins, although we'll see how the pharmaceutical industry will push things. Mold is an unsuspecting one because it likes the liver gallbladder, likes to hang out there. I see 3 types of people with reflux. One is your typical middle-aged, they really haven't done a good job taking care of themselves. You know, they're a little overweight. Maybe they're diagnosed with sleep apnea. They just don't feel their best self. And they're like, everything's kind of bursting at the seams for them. The other person I see is like a really stressed out individual. You know, stress is playing a really big role in creating some digestive discomfort. And the third person is a woman is generally a woman trying to get pregnant, wants to be pregnant or has been pregnant, and they have just a little bit of tissue laxicity. And so everything's a little bit looser. Stress does tend to play a pretty big role in reflux. You know, something that goes around in the conventional, or in our community, the natural health community, is low stomach acid. And I think that is a culprit, but I do think that there is a point at which we have high stomach acid first, and then it comes down to low when we've been chronically stressed. And really, who's not chronically stressed would probably be a better question. It's kind of like the trio of people I see, and mold can cause stress to the body. So
yeah, I see. There's always like when we're talking about stress, we always got to go beyond, like, yes, the emotional, psychological stress is absolutely massive. particularly after the pandemic and, you know, things changing so fast and people just being completely stressed out of their brains. Now we're all going into financial recession. I don't know how America is going, but Australia isn't doing great. Prices are, you know, up with everything. Interest rates are up, and so people are stressed out. But we're also talking about all the other stressors that come in: toxins, mold toxins, gut infections, parasites, all of that sort of stuff as well, right? Which kind of takes us to that SIBO topic as well, so that small intestinal bacterial overgrowth. So how do you see that fit in with the heartburn picture?
All right, so you take someone like my story who was put on PPIs and H2 blockers, so Zantac and omeprazole is the generic name. Sorry, I don't have your guys' trade names over there. And you give them Tums and you dilute the stomach acid, you make the pH higher. That's a great way to create bacterial overgrowth, whether that's H. pylori, which is a contributing factor, although I think it's a commensal, much like other pathogens that we think about in the body. You increase the stomach acid, and then you put the stress the person's already under into the system, and boom, two things happen when we're stressed. Either you are scared shitless or you poop your pants. It just depends on which part of the nervous system is your default, where you fall back into. So I see constipation a lot with small intestinal bacterial overgrowth, more than I see it with diarrhea, although, you know, you can't rule it out when there's diarrhea. And I even have a patient that has totally normal bowel movements and he just has horrible bloating, and that's it. And that's his only symptom. Didn't take PPIs, none of these things. Just, you know, some people are more prone. Maybe big athletes, you know, people that, in his case, he's a pretty big athlete.
Yeah,
lack of movement.
It's that connection of going, you know, when people are bloated, where is that bloating coming from? Well, we've got to work through the digestive tract in an order, right? The top of the digestive tract, are you chewing your food enough? Or are you so stressed out that you're just swallowing your food in whole bits and pieces? And I think I heard you say the other day, your stomach doesn't have any teeth.
I love saying that because it's so true.
And it is so true, right? So that's already where the stress picture often starts. We rush our food, we're multitasking, we're looking at screens while we're eating, and we're actually not paying any attention. And that digestive process really starts happening in the mouth and then in the stomach, as you just said. And then, you know, if there's problems further upstream, that can obviously then create problems further downstream. So we got to have an order in that digestive process and kind of go, well, what's really causing you to be bloated? What's causing you that fermentation that's actually going on? It can come from a whole range of different areas in the digestive tract.
And what people, I think, get a little confused is that we're not supposed to have bacteria in our small intestines. We're supposed to have certain bacteria there, just not our colon bacteria that are meant for fermenting. Like, the body is made in a very specific way. The colon is able to handle fermentation. Like, if you think about the anatomy of it, like, it's much larger. Like, I don't know if it's triple the size of our small intestines, but it's a lot baggier. Our small intestines are pretty skinny. And like, then you add something that like produces some kind of fermentation gas that causes that bloating. God, it can be so painful. One of my mentors, who was a midwife for a long time, she compared the pain of gas and bloating to labor. I haven't had a baby, but man, I was like, that is a big statement to make in my mind.
That is a big statement. Yes, I have had babies. I don't know. It's just very different, but I don't think I have never had SIBO. So I've been bloated and I have had lots of different gut issues, candida and thrush that obviously also comes from the gut, through overgrowth kind of thing. I've had acid reflux, but funnily enough, my acid reflux, as you mentioned, was more in pregnancies at the late stages of pregnancy, where the baby is just so bloody big that it pushes all of your right under your diaphragm, and it's pretty hard to digest your food properly.
Yeah, but you're creating the future, so you know, we sacrifice a little bit of our own comfort when we have a little baby cooking inside of us. And I kick that. I just like imagine like kicking straight up into the liver. Oh, painful.
Yes, that is definitely painful when you get those little
I'd love to ask you, Have you seen anybody develop reflux after they had COVID?
Not directly, no. Lots of other different symptoms, but acid reflux doesn't seem to be the main sort of complaint that people
Not the main complaint, but it's like, I've had a few people reach out to me that they got COVID and they got a resurgence of their reflux that they took care of 10, 15 years ago by the typical PPIs and acid blocking medications. In my mind, you didn't get to the root cause, which is why you got sick and why when you got sick, it aggravated it and nothing is working now. So now they're like grasping, like, where's the natural thing? What can I do to actually treat this and, be done with it for real? I think that's pretty interesting because you're right. It's not all people, but it's a handful of people. And I've asked a few other folks that are in the gut health world and they've seen it too, which is interesting to me.
Yeah, I'm sure there is a whole, web of things coming in. Like COVID seems to cause crazy amount of issues. I've definitely had a lot of come in with smell, losing their smell and their taste for months and months and months, which can be really distressing for them as well, because it's really not fun to not have any taste buds anymore, right?
Oh
and
my God, so terrible.
But you don't actually realize how much it affects you until you have the problem, and it really makes them very depressed. And yeah, thankfully we've resolved that, but yeah, it's crazy what's ongoing there, and what the cost on the healthcare system is with that as well, and people not finding much help there either, right?
No, definitely not. And, interestingly, with the loss of smell, Parkinson's, that's one of the first symptoms along with constipation. I know we weren't talking about that, but kind of, you can have chronic constipation 20 years before you get a Parkinson's diagnosis because it's a nervous system component. Like, it all goes back to the gut. Like, the gut tells a story that's so detailed. If we can have an astute practitioner that's willing to listen to the symptoms and put the whole thing together, rather than just say, oh, you have reflux, take a PPI. Oh, you have SIBO, take rifaximin and hope for the best. I'd love to hear your perspective on relapsing with SIBO, because I see a lot of that.
Yeah, it's absolutely huge. And that's because SIBO is not the root cause, right? It's just a bacterial overgrowth. It's just too many of the wrong bacteria in the wrong place. And then we got to ask what's causing this. And in some cases, yes, the nervous system part of the gut can start to be degenerated. And particularly because I'm in midlife and I work with more sort of midlife women, we do have to start to worry about these things because, yeah, it can be decades earlier that we, have. And often the gut nervous system degenerates first, and that's why the first sign of Parkinson's is actually often the chronic constipation in the gut. And so that's definitely one of the things that we can't ever rule out. If somebody has, an ileocecal valve that is just purely because it's a piece of fascia in the end, right? This is the valve itself. It's just tissue. And that can become very overstretched. If you've been distended and bloated in an extreme way for many, many years or decades, for some of the people that come in, that alone, that pressure, that intra-abdominal pressure that happens from the gap fermentation pushes that valve open. More bacteria, move into the wrong direction. They go back into the small intestine where they're not meant to be. And that valve constantly that piece of fascia constantly gets overstretched. So then we got to ask, yes, we can do some visceral manipulation and I'm trained in that, but if I work online with people, I can't do it for them. But there is obviously osteopath and other practitioners that can work with the organs and with the ileocecal valve to an extent, right? Like we can't go in with an operation and get the ileocecal valve fixed. We can try and, enhance that movement. And I think I've also seen some interesting research that, with something like herbal, like an iberogast, those motility herbs, that they are able to restore that, innervation of the ileocecal valve and to an extent repair that migrating motor complex a little bit that moves things through. But, you know, for how much, we don't know. How much is it damaged? We don't know, because everybody's different and everybody's individual. So that's why I think SIBO can be quite high in that relapse rate. And we've got to be, you know, have a maintenance plan and an ongoing care plan in place, something like a motility herb that just keeps moving things through for them if their own nervous system doesn't kind of relearn how to do that, right?
Mm-hmm. Yeah, I'm a big proponent of Visceral. I love that you know what Visceral is. There's not enough people that do it. It's a lot more popular in Europe than it is in the States, and people get weird. I know it. I often refer out. I have a great practitioner in my area. He's been practicing for over 25 years. So it's like, I'll do a little in office. And then you're right. Like anybody I work with online, I try to teach them how to like palpate their sphincters. It's tricky though, because people are like, they don't know. And I don't know what you find, but I find that people are really weird about touching their own belly.
Yeah.
Like we're so disconnected from the fact that like we can massage our own body, and no, you're not going to hurt yourself. You're not going to burst your organs. Like, I don't know where some of this stuff comes from. And maybe it is trauma and programming. I don't know, but we need to get reconnected with our body. That would be very helpful for people, not just dealing with reflux and gut issues, but in general, like really tuning back into our center.
Yeah, absolutely. I mean, the organs are your prime real estate. People are always surprised when I start body work on their organs, and like, why do you want to touch my tummy? Like, I want you to rub my back, sort of thing. It's like, your spine is 3D, and actually your organs is where the whole inflammation sits, right? The lymphatic system, a lot of your gut nervous system, your immune system, all of your organs are like the prime real estate. So if I can get the lymphatic flow back, if I can get some more movement and blood flow happening in those organs, it's so informative for that vagus nerve connection, that brain connection, and then a lot of magic can happen from that. So yeah, absolutely. I always teach people, you know, their own little tummy massage, their own little skills, and that can be such a, you know, that extra 5 or 10% that they needed to get that healing process started.
Yeah. And I find that Visceral or colonics or enemas are like totally mainstays. Not that you need to, there's some lady on social media that was saying you need to do coffee enemas every day. And I'm just like, no, please don't do that. Like the treatments that I recommend is like twice a week for 2 to 3 weeks, depending on the individual. Like, please consult with a practitioner that knows what's up. And then for another 5 weeks, once a week. Like, and you know, in a comfortable setting, like it takes about an hour start to finish. Like once you get good at it, you know, this everyday thing, like we're not trying to create dependence. We're just trying to retrain the bowels how to hold and relax, which is what colonics and enemas both do. Enemas are a little more accessible to the average person because you can buy kits online, whereas colonics, you have to go in. And I'm a fan of the open system, but the closed system does help to increase tone of the colon a little bit better than. Definitely a fan of castor oil packs. Love me some castor oil packs. Yes. Anyway, colonics. I'm a big fan of them. Anybody dealing with chronic constipation, which I do see as a main symptom or a concurrent symptom with reflux often, and pretty much almost always with SIBO issues. And you're right. It's not SIBO in of itself doing the herbal or pharmaceutical medications. That very rarely solves it, which is why some of these other things, motility herbs, things like ginger and artichoke are things I use. And then visceral manipulation, finding a practitioner, chiropractors, osteopaths, if you can find a real osteopath, not these guys that just do emergency medicine. Not that that's not real medicine, but like traditional osteopaths actually put their hands on your body and do body work. And they're hard to find these days. I don't know about in Australia, but they're pretty much no different than an MD here.
Oh, I didn't know that. And
it's tragic.
Yeah, they're definitely proper musculoskeletal doctors. My husband is an osteopath, so
awesome.
Cranial work, visceral work, you know, work, all of
love it.
Depending on what you specialize in, obviously, but everybody is very on here. Yeah, that's so interesting. I didn't know that.
It's a bummer. It's a huge loss, and you know, I think it goes to like political shenanigans, I think, are playing a big role there, unfortunately.
Yes, it's so interesting. Yeah, so I agree. Like, if we're not supporting the gallbladder, for example, that can be another root cause of, if you're not releasing enough bile, or a lot of the midlife ladies have had their gallbladder removed already. There is a problem there with the bile flow, and so you're not emulsifying your food, and then it ends up fermenting in the small intestine. Well, it's not going to be by taking endless amounts of antimicrobial herbs. It's going to be fixed by going, okay, we need to help the gallbladder, right? Or support the stomach acid, or thyroid problems is another very
huge,
obviously, right? If you have a hypothyroid, your digestive system is going to slow down, and you're going to get more constipated. You're more prone to gallbladder issues and sluggish bile flow. And then there's your recipe for disaster in the small intestine as well. So I always look at thyroid labs and make sure that that's functioning optimally as well. Is that something that you do? Obviously, yeah.
Oh my gosh, yes. And actually, I've even seen people presenting with hypo symptoms and have hyperthyroid, whether it's from early stage Hashimoto's or not. I like to run a minimum 3 thyroid labs on all new patients: TSH, free T3, free T4. And if I suspect thyroid dysfunction, I run anti-TPO and anti-TG labs. I had a patient tell me that their doctor wouldn't run antibodies because antibodies couldn't possibly raise before TSH effects. And I don't know how elevated antibodies would affect thyroid function. I'm just like, did you not sit through physiology? Like, I'm not trying to be a jerk, but like, this is basic in my brain. Why are we arguing about running this $15 for each of the antibodies? And I don't understand. It drives me bonkers. The bar is low is what I'm saying.
Yeah, I get that all the time. It's absolutely impossible to get a GP in Australia to run antibodies. I very rarely and this is for ladies who have been diagnosed already with autoimmunity because they say, oh, it's not relevant, the antibodies are not relevant, or for ladies where I have a high suspicion that they've been put on thyroid medication because they're hypothyroid, but no one's ever run the antibodies. And it's like, hello, can we just be thorough and check if it's an autoimmune thyroid?
Yeah, exactly. Because the most common cause of low thyroid is Hashimoto's thyroiditis, which is an autoimmune condition.
Yeah.
And generally where there's one, there's multiple, whether it's celiac is the one I see most commonly paired with Hashimoto's.
Yeah.
And thyroid function, gallbladder function, I would love to hear what you have to say about folks that get their gallbladder out, because I've had patients as young as their like mid-20s get their gallbladder out, which is so tragic. Do you find practicing Visceral that you can still feel the motility of the gallbladder even though it's gone?
Yeah, it kind of leaves an energetic imprint, and it's obviously the fascia, around it, however they've stuck it back together, whatever they've sewed it back up, that's always the interesting bit.
It's always interesting.
You can feel the scar tissue, and you can feel the restriction of that scar tissue. And it's also very interesting how many people feel quite sick when you try and touch their gallbladder. So if they still have a gallbladder, and I felt that on myself, you definitely have to be very careful and gentle trying to kind of squeeze people's gallbladder, because it's such a, nervous system reaction. You can feel really, people have to vomit. But yeah, it's really quite full on. But I knew I had a problem when I was worked on, and since it's fine, I don't mind people touching my gallbladder anymore. So I definitely know it can improve from visceral manipulation.
100%.
Yeah.
Oh yeah.
So yeah, let's answer some questions. Hey, I think we've got heaps of.
There's some good ones. I love answering people's questions because it always helps my brain. Like, what are people thinking about?
Yeah. Yes, what are people thinking about? So last person, my Paradise Forever One says, I have hyperthyroidism. Do I need antibody testing?
Yes. You got to find the root cause. Like, okay, great, hyperthyroid. Thyroid doesn't just go wacky just because it wants to. Something is causing it.
Exactly. exactly. And, you know, you want to have all of those questions answered. You want to be comprehensive and thorough, and why not find, like, as you said, actually not that expensive to run them.
It's really not. And that's my prices. And I'm just me in practice. If you go to a big clinics get better deals. Like there's different pricing structures for labs, and hopefully I don't get in trouble for saying that. But this whole thing, it's too expensive. That's the most ridiculous answer I have ever heard in my entire life. That's baloney. You really got to advocate for yourself, and like ask your doc. One of the things I've been having my patients do is ask your doctor, are they willing to write that in your chart that you refuse to run your antibodies? Because guess what? They'll run them. Because it's a CYA thing.
That is a good one. That is a good one.
I don't like to have to threaten, but like, come on, people. This is just basic following their own rules. This isn't my rules. This is their rules.
Yeah, that's fantastic. And so somebody is saying, I've been taking Prilosec forever. I heard apple cider vinegar can help instead. Thoughts? I don't know. That must be an American one.
Yeah, Prilosec, it's like a meprazole or esomeprazole. I forget. I have mixed feelings about apple cider vinegar for a couple reasons. It can be very beneficial. Kind of, if apple cider vinegar is beneficial for you, it's a gallbladder problem that you're having. If it is aggravating, you likely have some form of gastritis or esophagitis, some kind of inflammation in the tissue. And that's what happened to me, is like I was like DIYing online support, found apple cider vinegar, set me into one of the worst reflux flares of my life. I still remember it was like 10 days of the most agonizing pain I've been in. So I have some hesitancy, but if you know you've had a clear EGD that's totally clear, everything is normal, there's no gastritis, like actually clinically normal, then maybe it would be worth a try, but at your own risk. I'm not recommending anything.
Yeah, exactly. There is that big apple cider vinegar trend, but I'm always like, yes, it's just a vinegar. You might actually have it in a restaurant when you go and have your salad, right?
Yeah, exactly.
But yeah, people that have an underlying issue, irritated stomach lining, H. pylori that has already caused some damage, that sort of stuff, you're really going to burn. And it's almost like a very painful and very bad self-test, right? Take the apple cider vinegar and go, oh, this is really hurting. There must be something there. But that's why we be cautious with it, and that's why we don't want to just willy-nilly recommend it. And that's the problem in, you know, the natural health world as well. We've got to be careful, and we've got to consider that there is, you know, lots of different options why you're having your acid reflux, and there's not a one size fits all. Everybody should be taking apple cider vinegar. It's not, that doesn't work like that, unfortunately.
No, that's true root cause investigation. And, you know, one of the downfalls of the DIY, like it's great that we have this available, these tools, but it's try at your own risk. Trial and error has its own benefits and negative consequences.
Yeah. So somebody, Nadina Kamal, is saying, please tell us something to get rid of acid reflux and bloating. That's a long topic.
It's a big, given that what we just talked about was root cause, like there are literally dozens, and we only talked about a handful of things on this chat. Like there are so many things that could cause those problems, and you've got to get to the root cause rather than just saying like frivolously, like everybody should be doing apple cider vinegar, or one of my favorites is aloe. And I just try at your own risk. I don't know if you've got like a good little spiel you like to give people when they ask you big questions like that seem like they would be easy.
Yeah, it's again, because people think there's one reason for bloating and there's one reason for acid reflux, because that's kind of how, you know, normal medicine works. Like, take this drug and it's going to be fixed, right? So that's not how the body works, though. The body is very complex, and as you say, there's lots of different root causes for either heartburn or for the bloating. And obviously, if you have heartburn, you can also be bloated, and you can or constipation, or none of the above, right? So
right.
Again, I would always start with working through the digestive system, top to bottom. So are you bloated because your stomach acid isn't adequate? Are you not chewing your food properly? So start with the mouth, right? Do you have maybe even, you know, bleeding gums, and like microbiome in the mouth isn't that great? You have infected teeth and stuff there. So each time you swallow that bad microbiome into your digestive system as well.
Yep.
Yeah, how stressed are you? Do you need to address your stress levels? Do you need to sleep more and de-stress and do all of those sort of things? You know, how is your nutrient status? Do you have all of the nutrients like zinc and minerals to make stomach acid, right? You also need to be able to produce it. So yeah, we could keep going, you know, talking on for an hour, and that's why, you know, working with a practitioner is obviously the fastest way to get there. Yeah.
Yeah, I love you talk about the oral microbiome. I had someone actually argue that the mouth has nothing to do with my reflux to me, and I was like, that does not make sense. Like, a lot of people will get a coating on their tongue when they have reflux, whether it's white or yellowish. I always like to ask, are you drinking coffee? Is this a coffee stain, or is this because you're actually regurgitation and it's yellow because of the stomach acid that's regurging? Whether you get it or not symptom-wise, like, silent reflux is much more common than I originally thought for my education. I actually think it's more common than your typical, I feel the burn, my stomach is kind of painful, and I'm having regurg itself. Like, pretty interesting.
I agree. A lot of people have that little cough. They have that the weird sinuses. They have all of these other signs, or like the teeth needing, you know, constant care because they're losing their teeth because the acid is eroding the teeth. So yeah, definitely something that is super, super undiagnosed and can go for years without people putting the two things together and going, oh, I don't have postnasal drip, I actually have an acid reflux.
Oh my God, the postnasal drip, until proven otherwise, is silent reflux. Where this whole thing, it's allergies. I'm not sure where that came from, but I love that you, yes.
We're vibing. We're
vibing.
So Jazbuto, I don't know how to pronounce it, is saying, how did your acid reflux clear up? I was diagnosed with Barrett's, and so far I'm okay, as long as I keep taking my omeprazole.
Yeah, so I had lunch with a general surgeon a couple years ago. He's retired now. He's actually a DO. And I thought his perspective on Barrett's was very, very interesting, because he was right in his prime of his career in the 80s when proton pump inhibitors became like a mainstay of acid reflux treatment. And he brought to my attention that I might want to look into the data around the development of Barrett's disease and taking proton pump inhibitors. And I was like, well, that doesn't make sense. Like, that's not what I learned. And sure enough, in the data, people that take proton pump inhibitors are more, how do I say this? Have a higher disposition to develop Barrett's disease than if they didn't take a PPI and just stayed with an H2 blocker. Now, the problem is PPIs work better, meaning you don't have as many symptoms, but you're suppressing the symptoms that are telling you something is going on, and it's not actually solving the problem. Whereas H2 blockers I slightly think they're better medications than PPIs, but again, they don't work the same. They're not as efficacious at their reduction of symptoms. But this is where working with an alternative practitioner that has good knowledge of herbal medicine, because there are things we can do for Barrett's to help resolve it and help you get off PPIs once and for all. Throat surgery is not the friendliest on the body. The throat tissue is very, very sensitive. Does not really like that. So
yeah, and again, I always want to be extra cautious, because it's obviously quite an advanced stage, like a pre-cancerous stage. So it's very, very tricky, to get off the medication. You don't want to put people at more risk. So that's why we're kind of here. We kind of want to say to people, please don't let it get to the point where you unfortunately already have a diagnosis that's far down the track. But there is still, things we can do and things we can help. And also just I think we haven't really mentioned that, but you can get so dependent on all of these drugs, and then you think you've got the worst acid reflux when you try to come off, but it's actually the withdrawal symptoms from the drugs. And you have to go through this extensive weaning off process, right, to kind of get people off, which can be horrendous.
Yeah, I would definitely recommend working with someone. Please do not try this on your own if you have an advanced stage, like just reiterating what Eileen is saying.
Yeah, perfect. Perfect. Any other questions, guys? Other than that, thank you so much for the chat. I feel like we could chat for another couple of hours. I definitely want to get your secret for barrettes. I'm going to message you afterwards. Like, how do you do that?
We'll talk. We'll talk. Well, yeah, thanks for having me. I really appreciate it. And I'm glad we were, vibing in the same way. Like, we don't know each other a lot, but we've been following each other for a little while. And it's always good to introduce each other to our own audiences and help our followers, because that's really what I'm here. Like, I'm not getting paid to do this. Like, I'm doing this because I love to talk with other people that have similar interests, that want to help other people get well, because there's so many options out there. And I think that that's what people don't realize, is there are options outside of pills and surgery.
Absolutely.
You can follow me on Instagram. That's where I'm most active, naturopathic_Dr. Shayna. Maybe she'll put it in she's posted in her stories.
Yeah.
Her stories.
And I'll put it under this video as well. So this video will be saved. I'll link it all up to you. And please let us know if you have a special offer at the moment, how people can get in touch with you, and stuff like that as well, and how they can book with you. Obviously, you've got a link in your profile.
I've got links in my profile. I've got a free guide for reflux. Would be helpful for people dealing with Barrett. So, Steve, and I've got a booking link if you're interested in potentially working with me. It's a 15-minute call. I'm not trying to waste anybody's time with those fancy 45-minute sales calls. Like, let's get straight to the point. Can I help you? Do you want to be helped? Do you have the finances? Because I don't do this for free. I do the content for free, but at the end of the day, we have family to take care of. We're trying to do our work, and fortunately for us, we get to do things that help people, but also help us as well. So it's like win-win for everybody, which is awesome.
Love that. You could be German. I think you might have been a German in your past life. You're so direct and to the point, and like, no bullshit.
Yeah.
What I love about you, that's why I could talk to you forever. So thank you so much. Really appreciate your time.
Thank you for having me. Bye-bye.
Keep shining your light. Bye.